So how can we help our patients become more adherent? Well, obviously, we need to, make sure these patients can make informed decisions. And women who reported that their role in treatment decision-making was less than they wanted were more likely to be non-adherent. So we need to make sure that the patients have the tools to make the proper decisions in this context. So I know we're doing this. We are reviewing risks and benefits with patients, but I think we could be doing it better. And so knowing this, how will this affect how you counsel your patients? Well, I think certainly most of us do a pretty good job in terms of seeing that patient when they're first in the clinic. Some of us, unfortunately, those of us in Ontario, sometimes don't get to see these patients because they go out into the community. And I think it's really important to make sure that the community pharmacists are also part of this process, because I think that sometimes that's where, and it's not necessarily the fault of the community pharmacist, but sometimes it's where the ball gets dropped because they don't have the training that we do. So knowledge is everything. These are actually quotes from adherent women now. So it was important to understand how the AI was working, because by understanding I was able to focus on it working positively for me. Whereas if I just took it not knowing what it was doing in my body, I don't think I would have thought as positively about the outcome. And this is a patient talking about a visit to a physician's office. She had on the wall the AI and all the pictures of the breast and how the AI suppresses the estrogen, and I liked that. I loved the way she explained it on her walls. I said, my goodness, this is something unusual with the arrows and everything, how cancer starts, how the medication works. She showed me everything, and I loved it. So how can we better support patients in adhering to hormonal therapy? Obviously the patient care experience is important, and we need to look at trying to give the patients the best experience rather than patient traits like age or disease stage, because the patient care experience seems to affect ongoing hormone replacement therapy use positively, even among patients with side effects. And patients sometimes, if you're not, that went forward too fast. Patients who have not been asked about difficulties, they have that has a negative effect on adherence. So I think this is a real good argument for callback programs. And I think that that's a way that we can really support and help our patients and affect adherence in a positive way. So, and that also ties into the last point here, where patients who reported having less support were less likely to continue treatment. So we need to figure out how we're going to support these patients on an ongoing basis. So knowing this, how will this affect how you support and follow up with your patients? I hope so. But the question, of course, is who should be doing patient follow-up? Because we're all busy, and this is a difficult thing to do, and there are many, many, many patients that end up on these drugs. In an ideal world, we could follow up with them all, but obviously this isn't an ideal world. So who should be doing it? How often should it be done? That's an open question. And are we missing opportunities to ask patients about adherence? Because this is something that doesn't get asked about very often. I can tell you when I was giving this talk to a physician group, or at least there were some of the physicians in the group, they came to me afterwards and said, this is not something that on follow-up visits that we ask our patients, and it's not something that we necessarily think about, but we probably should be. So, and in terms of support, there's certainly programs out there that we can refer patients to. There's the Harmony program for Arimidex. There's sharingstrength.ca, Look Good, Feel Better, and as well the Canadian Cancer Society is a good support. So I'm going to turn it over to Karen now to summarize. And thank you very much for your attention.
Thank you, Tom. Can everyone hear me? All right. So, in summary, what is the scope of the problem? So if we go back to our original survey, I think majority of us said 70% of patients, we thought that about 50% of us thought 70% of the patients were compliant. Maybe that's really not the case. So I think one of the things is that, as we found out, compliance does decrease with time. So somehow, as Tom suggested, we need to find a way to maybe review how important it is for those patients to be adherent. Education seems to be a big piece of this. The other thing is, I know for myself, when they come back and get prescriptions, we don't often ask them whether they are having adverse effects. We kind of assume that if they're having problems, they're going to let us know, which maybe isn't the case. So maybe we need to just be a little more forthcoming with asking them questions about adherence, about side effects, anything else that may affect their taking the medication and getting the most benefit out of it. And referral programs, so not always thinking that we have to do it all by ourselves. Using the referral programs that Tom mentioned that are out there to help patients.